Over the past few weeks, there's been a lot of discussion around Lindsey Vonn, her attempt to return to elite skiing, and the recent crash that reminded us all just how unforgiving high-level sport can be. Before the crash, many people were asking, how can someone possibly compete with a torn ACL? And this opens up an important conversation about injuries, risk, and why certain athletes can sometimes push the limits, while most should not. An ACL tear is one of the most common serious knee injuries in sports. For most athletes, it leads to instability, giving way episodes, and a higher risk for further damage to the meniscus and joint cartilage. That's why the usual and prudent path is to restabilize the knee before returning to high-level competition. That said, Lindsey Vonn is not the first athlete to push the limits. There have been other rare, high-profile exceptions. Philip Rivers played an AFC championship game just days after tearing his ACL and meniscus. Klay Thompson sank free throws in the NBA Finals after rupturing his ACL. Tiger Woods competed and won major tournaments while playing with a torn ACL before eventually having surgery. These stories are real. They're remarkable, and they show how resilient and tough elite athletes can be. These cases are exceptions, not the rule. Most athletes cannot safely or effectively perform with an unstable ACL-deficient knee, especially in cutting, pivoting, or high-impact sports. Repeated instability episodes don't just affect performance, they increase the risk of permanent damage to the meniscus and articular cartilage, which can lead to the development of painful arthritis. So while Lindsey Vonn's determination is inspiring and absolutely worth admiring, it doesn't change the fundamental principle. ACL injuries require proper treatment to restore stability, protect the knee, and optimize long-term function. Elite athletes can sometimes defy the odds, but sports medicine is not about gambling. It's about stacking the odds in your favor. Ultimately, it was determined that Lindsey Vonn's ACL was not the cause of her crash, but the situation in the weeks leading up to it highlights just how extraordinary and how risky competing with an unstable knee can be, even for a once-in-a-generation athlete under constant medical supervision. For the vast majority of athletes with an ACL injury, the smartest play is not pushing through with an unstable knee. It's getting a proper orthopedic assessment and a management plan to restore stability, protect the meniscus and cartilage, and preserve the knee not just for today, but for the years and decades ahead.